Recently, it's become popular to talk about mommy makeovers, and certainly part of that perception of a mommy makeover is a breast lift. And a breast lift basically puts the patient's own breast tissue back where it started before they had kids. Sometimes a breast lift is combined with a breast implant. Sometimes it's done exclusively on its own, so they're using just the patient's own breast tissue to give them back the shape that they want. The way that we know whether a patient needs a lift is by feeling in an examination where their nipple lies. Their nipple should be at the level of the crease behind their breast. And if it falls significantly below that level, then those patients often need a breast lift. We try to keep the incisions as small as possible, but certainly one of the important things with any breast lift is reducing that skin envelope and trying to get it as tight and as attractive as possible. Breast lifts are done as outpatients under general anesthetic, and patients, while breasts are very sensitive, often have very little pain, as most breasts are just made out of fatty material which doesn't have a particularly good nerve supply. The incisions are kept off the cleavage so that patients can wear most clothing without anyone seeing their scars or hinting of the fact that they've had this procedure done. Sometimes we have patients that come in and they don't know that they need a breast lift. They come in thinking that they might just need a breast augmentation. But unfortunately, if you need a breast lift, you really need to have a breast lift. The consequences of not having the lift are that the implant, if you end up having an implant, will sit too high and your own breast tissue will appear to fall off the end of that implant. Not an attractive look. One other nice thing about breast lift procedures is that we try to do it in a way that preserves all the natural nerves. And so patients don't lose sensation and they keep their normal sensation without any problems.